Serious. Doctors of Reddit, what is the rarest disease that you've encountered in your career? Patient admitted for something unrelated starts deteriorating for no discernible reason. Has some mild generalized abdominal pain, but other than that no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast CT, there's fluid everywhere. Organs pushed against the abdominal wall. Just one enormous gray puddle from the top of his pelvis to his diaphragm. And then, at some point, there's a scribble of white pretty much smack dab in the middle of it all, in this context, signifying active bleeding. It was shaped like the world's smallest firework pop, and it was nowhere close any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous, atraumatic rupture of the cystic artery. No surgeon in the building had ever seen one. Dude underwent embolization and made it out completely unscathed. So his entire torso was full of blood? Dermatologist here. Some fun ones. Chrome hydrosis, where sweat comes out in different colors. My patient's was blue. Argyria, a permanent discoloration from silver overdose. Aquagenic urticaria, an allergy to contact with water. Greater than aquagenic urticaria, an allergy to contact with water. How do you even live with this one? Is it skin contact only? How do you bathe? Objective tinnitus. I could lean close to the patient's ear and hear a ringing noise coming out. Central deafness. Patient had an anoxic brain injury and was essentially deaf even though there was nothing wrong with his ears. Well, you answered the question, do you hear that too, or am I crazy? Which I bet was a relief for the patient. Pseudocyesis or hysterical pregnancy, in a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus's triplets and had grown a massive pregnant-looking belly, was producing milk, etc. I really wonder whether it's cognition trying to make sense of hormonal imbalances, or the other way around. Gorham's disease aka vanishing skull syndrome. A softball-size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brains. Crazy disease. My best friend in high school had this. Part of how I got interested in medicine. Actual scurvy. Poor old man didn't know how to cook after his wife died and ate nothing but biscuits. God, this makes me worry about my own pops. After the divorce he basically subsides on hot dogs, chips, and uncooked ramen. Every time I cook for him he reacts like I just gave him a 3-star Michelin meal, even when it's something as basic as quick spaghetti that I still can mess up. Edit. Thanks a million for the words of kindness and solid advice, people. I truly love you for it. Fetus in fetu. 10-year-old boy, pregnant, with his parasitic twin, PT. Edit. Case 10Y. Oh. Boy came in with enlarging abdominal mass and intermittent generalized weakness. Imaging revealed a parasitic fetus, which was also growing in size. History revealed mass noted 2 years ago which enlarged rapidly the last 3 to 4 months. Within days of admission, boy's organs begin to fail with no apparent reason. He was healthy and eating well when he was admitted. Family wanted surgical intervention to separate the parasitic twin against surgeon's advice. Parasitic twin was basically starving, poisoning the boy to death. Surgeons opened the boy up and found that the boy and parasitic twin share a stomach, liver, heart, blood vessels, mesodermal organs, basically too complex to operate. The boy passed away after. This happened to a poor family in an underfunded government hospital in a corruption-infested country. The parasitic twin was donated to the hospital. It had teeth with hairy limbs with the longest curved baby nails. I can't describe it further. It is on display at the surgeon's hall. Edit 2. This happened years ago before the age of smartphones. The hospital team tried to have the tissues studied for academic purposes. There was a case report about it presented in a local medical congress, but as this happened in a third world country with limited resources, nothing came of it. I live and work in a different country now. Last edit. NSFW if you want to Google it. Wait, what? How do you tell a 10-year what's going on? Is the twin a living creature at this point? Fibrodysplasia ossificans progressiva, FOP. A disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of her body. Also had a spine that resembled a small turtle shell. I scrolled the thread looking for this as my sister has FOP. She's now 36 and a lot more is known about the disease than when she was a child. Lack of information in her youth led to several misdiagnoses and attempts to treat or operate actually cause flare-ups which can quicken spread. Walking corpse syndrome, Cotard delusion. 17 years in mental health and I've seen it once. The belief that some or all of you is dead. The guy was so certain he was dead he believed he was a zombie. You might be interested in how people are enslaved as zombies in Haiti. There's a cultural narrative about becoming a zombie and being controlled by the one who resurrects you. Victims are poisoned and subjected to a ritualized death and resurrection. Then their slave doses them with a drug each day. They believe they're dead and have to serve the person who resurrected them. I don't remember the details on the drug used. We had a patient once, a young girl, who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using two metrics. The sample was considered female if it, 1, lacked Y chromosome, asterisk and asterisk, 2, was heterozygous on X chromosome, implying there were two copies of it. Otherwise the sample was considered male. This one sample registered as female on metric 1, no Y chromosome, but male on metric 2, very little heterozygosity on X chromosome, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turned out that the parents of that poor girl were asterisk brother and sister to each other, asterisk. As a result, she had very little genetic variation throughout her genome, not just X chromosome, and was consequently very sick, with a plethora of diseases typical for consanguineous births. Did they not know they were siblings? Persistent genital arousal disorder, having multiple orgasms a day, at any time, without any stimulation, becomes quite bothersome and uncomfortable, limits your daily activities and sleep is interrupted. Over time patients can become very hopeless. It is remarkable the dissonance between the name and the obvious joke, and the tremendous suffering these patients endure. I remember hearing about a few women with this on some primetime show like 60 Minutes or Dateline or something like that. I was a teenager so of course I thought it was hilarious for about 30 seconds until they started talking about how horrible it was and that it basically ruined their work lives, relationships, and everything else. It was pretty eye-opening. Harlequin ichthyosis. In med school there was a baby born with this. Basically their skin scales up in peels, removing that very important barrier, so kids born with this don't live long. She was just a couple months old and had not yet left the hospital since birth. I have a coworker with ichthyosis. She has no fingerprints and her skin is scaly. She's also completely bald and very pale. Most people don't know because she wears makeup, wig and gloves. But I taught a fingerprint class one time and she mentioned it and we did a little print thing with her and it was cool. Geneticist here. I work in a pretty big hospital and we get hard to solve cases from all over the world. Some of the cases are so unique, there is literally no name yet the genetic disorder. So those would be the rarest. But for the sake of this thread, I will discuss something that is not the rarest, but is pretty rare, and one of the most interesting, Prader-Willi or Angelman syndrome. These are two extremely different disorders that are both caused by the same exact genetic mutation. The only difference is if the mutation occurred on the paternal chromosome or the maternal chromosome. If it occurred on the maternal chromosome, you get Angelman syndrome, which typically results in the child being overly happy, laughing all the time with light eyes and hair color, but also severe intellectual and physical disabilities. If the mutation occurred on the paternal chromosome, you get Prader-Willi syndrome, which results in the child having excessive hunger and can literally eat herself to death, but with only mild cognitive disability. These kids may go a very long time not getting diagnosed and will become quite obese. Bonus disorder if you're still here, Williams syndrome. With this one the affected individual has an extremely charismatic, outgoing and fun cocktail party personality. They are cognitively impaired in most aspects except for speech and have very unique facial features that are described as elf-like. Genetic counselor here. I'm thrilled to see a geneticist chiming in. It's like this question was tailor-made for the weird stuff in genetics. It's hard to talk about the rare disorders you diagnose when they literally don't have names, lol. Just offhand, I'd have to say a case of mitochondrial DNA depletion syndrome. Less than 100 cases reported. Rarest disease that I've seen in my career thus far would have to be leprosy. It's something that one hears about in antiquity and something I read about in books, but I never expected to actually encounter it in my career. In what country was this? Maybe not the rarest, but saw a 4 to 5 year old patient with Lesch-Nyhan syndrome on my PEDS rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is for whatever reason these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad, but definitely one of the more memorable cases from med school. Eye doctor here. Patient had bilateral acanthamoeba keratitis. Estimated that 0.0004% of contact lens wearers will be diagnosed with this condition in one eye. My patient had it in both. Acanthamoeba keratitis is a rare parasitic infection of your cornea. Would not taking out lenses frequently enough cause someone to develop it in both eyes more easily? The rarest I've encountered is kid syndrome, keratitis ichthyosis deafness. A 5-year-old, very sweet, blind girl who literally had rough, thick, opaque skin on the surface of her eyes. If it blinded her, why is the disease referred to as deafness? I had a patient who presented with purple, silver skin. He looked like a Smurf and the Silver Surfer had a baby. However, he was in the ER for abdominal pain and was highly offended when I asked him about his skin pigmentation. My first impression from across the room was that he was severely hypoxic, and I was amazed he was walking and talking. He made comments that made it appear he was a huge conspiracy theorist, so I was suspicious of colloidal silver toxicity. When I asked him about it, he shouted angrily, "I don't take silver supplements anymore." After some prying, he said he took them to self-treat for a prion disease which he self-diagnosed from the grape juice test, where you spit out grape juice into a petri dish and a fungus grows out of it. At this point I'm like, yeah, this patient is fucking nuts. I'm pretty sure he listened to too much Alex Jones and as a result permanently dyed his skin blue, a condition called argyria. Yup, colloidal silver will do that to you. Brazilian doc here. I live in a really poor part of an already poor country. When I was in my pediatric internship there was this baby with hepatomegaly, big liver. In my region, the first thing that you have to think about in this case is a disease called Kala-Azar, also known as black fever or visceral leishmaniosis. It is an endemic disease which there is a parasite transmitted by a mosquito that can infect people with compromised immune system, like people living with HIV, and kids. This parasite infects the bone marrow and simulates clinical signs of acute leukemia, like chronic fever, spontaneous bruises and bleeding. The patient develops anemia, leukopenia, low white blood cells, and low platelets. To compensate, some organs like liver and spleen take care of the bone marrow function to create new blood cells, and thus, get bigger. This disease is really common in my region, but really rare in other parts, especially non-tropical countries like the US. Anyway, as I was saying, this baby girl, about 1 year old, was admitted to investigate a hepatomegaly. But the catch was that she kept having those episodes of hypoactivity and sleepiness, and sometimes even faintings that would then get better after she was being breastfed. We then checked and saw that she was having lots of hypoglycemia episodes. Her lab was normal, and she had no other clinical signs that would remind of Kala-Azar, besides the hepatomegaly. The patient had HERS disease, a genetic disorder that makes you produce less glycogen due to an enzyme defect. Never hear of it before meeting this patient, and I think I'll never will meet other one. Interestingly enough, in this same time, I had a patient that was admitted with leukopenia, anemia and low platelets that was also hospitalized to rule out Kala-Azar, but he actually had Fanconi anemia, an also really rare genetic disease. In this one, the bone marrow slowly stops producing blood cells. Besides this, the patient also has kidney, facial, bones malformation and overall physical underdevelopment.
Thank you so much for watching and have a good day.